Welcome to the Reverse Mullet Healthcare Podcast. I am Ellen Brown with my special co-host,
Erin Martin.
And we are here. We get to talk about food, and we're super excited. Actually, Justin's walking in, so
Come on in, Justin.
But anyways, so super excited because we're here for a Live at Health edition. But on all seriousness, you're one of the guests I'm most excited to talk to because we are extraordinarily passionate about the need for food to be at the center of health, not just as medicine, as a prescription, but at the core of how we move away from sick care as our only option to something where we have health care. And so when we had the opportunity to talk to you, I was super excited. So Jim, without further ado.
I am Jim Jones. I'm the Deputy Commissioner for Human Foods at the Food and Drug Administration. And I just to riff on your first comment about food being part of healthcare, we just about a year ago when we announced this Human Foods program, we announced that our vision was that food should be a vehicle for wellness. So I think we're very aligned on
exactly.
that.
Absolutely. Exactly.
Quality.
Yeah. I have a rather loud voice on LinkedIn about the need to, and I mean, in all seriousness, I was in Boston last week at Katie Stebbins at the Tufts Food and Nutrition Institute of Innovation, the council meeting, and my two partners, Dave and Justin, were in Tulsa with Erin, and at her Think Regeneration event.
Yeah, so advancing food as medicine.
Yeah, so we take it very seriously that if we're going to be part of a value-based care, outcomes-based transformation in this industry, then we really have to put food at the center of that. So tell us kind of what you're working on, and then we'll ask you our one question about change.
Sure. So we have a number of really exciting activities right now in what we refer to as the nutrition space.
Yep. I'm giving you your mic. Sorry, I'm doing this real time.
Appreciate it. I'm going to start sort of with one that's about to hit a milestone. We're about to finalize a rule that will describe the parameters for when a food can say that it's healthy.
Okay. Awesome.
So all fresh fruits and vegetables are eligible to be healthy, but in the packaged food arena, we're going to be defining what has to be in a product to be healthy and limits for how much of certain things we don't want too much of.
It's fantastic.
Like sodium, saturated fat, added sugars. So once we've defined what can say it's healthy, we're then going to follow that with the development of a logo, so that you can get consumers can start to see on packaging some consistency around.
It's so confusing. Yeah,
exactly. It won't just be based on what the manufacturer wants to say in the label. They'll be able to put a logo on it, so you'll be able to identify products across product categories, within product categories of what's healthy. So that's one thing we've got going on that we're really excited about. We've had a number of conversations here just today with retailers who are very interested in helping us create more consumer demand around that. So that's very exciting. Another activity we have going on is that we have just announced in September is proposed. So we're taking comment from all stakeholders right now. What we refer to as phase 2 of our sodium reduction goals. These are voluntary goals. They relate to all packaged foods, 163 different categories of food, both packaged and restaurant. And it's phase 2 because phase 1 just ended last April. And that was a 2.5-year goal to achieve a 13% reduction in average sodium consumption by Americans. Americans consume way too much sodium in their diet. And at the end of phase 1, we're about a year away from having a full picture of how well we did. But because there's about a data lag of a year. The early data that we have indicates about 40% of the categories are already meeting or are close to meeting the first reduction, which is why we decided we were in good position to do a second reduction. This phase 2, the second group of reductions, phase 2, would reduce, if successful, another 13% of the average consumption of sodium in the diet. So that's another exciting initiative we have underway. And then the last one, and I'll let you guys start the questions because we have a lot going on
My
here.
blood pressure is already lower as we speak.
Is around front of pack labeling. And that would be a proposed rule. A number of countries around the world have front of pack labeling. We have a schema we're planning to propose in the next several months, where you bring from the back of the label to the front of the label in a way that's very easily understood by the consumer around 3 nutrients, I say in air quotes, that we know Americans are consuming too much of: sodium, added sugar, and saturated fat. You put that on the front of the label with some descriptor related to it. So those are 3 things we have going on right now that I think have great opportunity to really move the needle in the nutrition space.
And so you talked a lot about displaying and kind of reducing sodium and looking and being able to identify healthier products. How about, we've got a big differentiation. The Kellogg's issue is really hot right now about how in other countries, some of the ingredients, are safer in other countries in the same products, and they're not as safe in America. So what is being done at looking at that, and why is that? And how can we also warn people? We are saying this is healthy, but how are we going to assess if something is maybe more dangerous for them?
So chemical safety, which is another part of our program. So chemicals have to be authorized by the FDA for use in food. And so that has been ongoing for the last 60 years. Historically, FDA has not looked at its initial authorization, except for in what I would describe as an ad hoc way. Every once in a while, a chemical gets so much attention in the media that FDA will go and take a look at it. We are working right now to stand up a systematic post-market process where we are routinely identifying chemicals that we think warrant a reevaluation. Something has happened since the original authorization, like new data has been generated. We know more about a chemical than we did than the original authorization that would lead us to reevaluate it. And so we are planning on putting in place. We've got the early work underway to have a systematic post-market. It just becomes part of our program that we're routinely going back and looking at previously authorized chemicals.
Do you see a universe where there's fewer chemicals in the future, like as part of that process, or like is it just evaluation and it's not necessarily here? We're trying to reduce the number of overall chemicals.
So our objective is that chemicals that are authorized for use in food be safe. So I've done this in 2 other pre and post market chemical review and inevitably they will ultimately, based on an assessment, be determined not to be safe, and they will be removed from the market. Yep. But I don't prejudge any of them until we've actually done it. The objective is that anything that's authorized is safe. If something's not safe after an assessment, you take action to make sure it's either removed from the market or used in a way that is safe.
So I'm gonna flip it more into an opportunity perspective and say, so I'm involved in another podcast. Somehow I went from never in my life having any desire to be part of a podcast to now be part of 2 of them, but it's the Food is Health Revolution. And we had Eric Smith from Audacious on, and his whole objective is to create a system to be able to categorize and measure nutritional density. So it goes beyond just the ingredients in there, but the nutritional density that's involved in those ingredients, which I think is an interesting, right? So do you see opportunities, not specifically with Audacious, but just when you talk about packaging and labeling and really engaging consumers to give them information? Like, do you see a vision where maybe someday, I understand policy has to be enacted, but where people can really be empowered to understand their food better when it's shelf stable, when it's,
Yeah. So our healthy definition captures that concept of density of foods we want people to be consuming.
Right.
That my view is that we got 330 million Americans that we really want to improve their nutrition. And I want to do it for everybody. I want to be able to give everybody the information that
Absolutely.
And to me, that means we've got to work really hard at presenting information that is accessible to everyone.
Right.
You should not have to be studying this at all. You shouldn't have to spend a minute of your time studying this question. It should just be obvious. And so we in our work on front of pack labeling, we surveyed 9,000 people in this country, and we oversampled people who are known to be not have the same level of nutrition literacy. So rural Americans, poorer Americans, and because we want whatever label we come up with to be understood by everybody. Universally.
Cross
so you don't have to do a ton of education. You see it, you know what we're trying to say.
Exactly.
And so I think the healthy symbol is similarly. Everybody should understand what we're trying to communicate.
Yep.
So and that's fundamentally what we're trying to do.
So I know we only have like 3 more minutes, and I'm being respectful. I'm looking at your press secretary saying, I want to be respectful, because he said you are on a
Jones
very,
misses his flight.
you're on a very tight, and I am very grateful that you were able to squeeze this in. So I will be very respectful of that. But I'll just ask you, I think it's amazing that you're here at Health, because Health is like tech, and, it's a kind of the opposite of health, of really what healthcare should be. This is like the sick care conference, in terms of all the tools. What do you think? First of all, I love that you're here. So to me, it makes a statement. But secondly, if I ask you, what do you think could affect real change in healthcare?
All caps.
All caps, real.
What's the trick?
What I'm excited about. And I was on a panel this morning about it, and it relates to tech and nutrition. We're working with Instacart to help them be able to help their customers quickly understand what foods that they are buying through Instacart that are good for them. And I think that there are the technology is available right now, and it's generally going to be in the private sector. FDA is not going to invent these
Absolutely.
Products of working with companies who have this is part of their mission to see how our knowledge at the FDA, we have a lot of knowledge around nutrition, chemical safety, how that can then be translated in these technologies to help consumers buy and get healthier food. And I think that can play a huge role in how people get healthier.
Yeah, I agree.
Absolutely.
You guys have any last comments?
Apologize for my tardiness.
But you jumped in smooth as just smooth as
right
silk.
through the door.
You came right in, and it was all good. But
And maybe just like one last final question is, what do you think maybe we could learn from other countries, that maybe have, different quality standards? What do you think we could learn from them that we could incorporate them here in the U.S.? Because there's certainly people with better health in other countries. And so I'd love to see some of that incorporated.
Oh, you mean the Commonwealth study that I've heard cited like 25 times because of our position at the bottom right quadrant compared to the other countries with health outcomes?
Yeah, and I certainly, from a longevity standpoint, my background's in long-term care. I'm a gerontologist, and food's got this huge ripple effect on health span, longevity.
Yep.
And I know in other countries, people are aging better because I've been there and I've seen it. Just wanting to understand maybe how we could incorporate some of those values here in the U.S.
Well, 2 of the initiatives I described, front of pack labeling and voluntary sodium reduction goals, are things that we've learned from other countries' success. Both of them came from other countries having done such, and basically that's where the ideas came from.
Well, that's good to know.
That's awesome.
So I hope we
Thank
can
you
have
so
you for
much.
a full episode, and so we're not like speed dating, but we really appreciate you making the time on the way to the airport. So thank you. Thank you. Thanks for the work
so
that
much.
you do.
All right. Thanks, Jim.